Hello, everybody, and welcome to the Consortium of Universities for Global Health's annual Global Health Leader Awards. I'm Keith Martin. I'm the Executive Director of CUGH. And this is a time when we get together to honor our colleagues who have displayed excellence across a range of global health fields and areas, from our conference abstracts to honoring some of individuals across the world who have actually done extraordinary things in global health. And I hope this is going to be a fun event for you. Certainly it is for us, and it's a real chance for us to celebrate excellence in global health. And clearly this has been a very difficult and challenging year, but despite the difficulties we've all seen around the world, many have continued to rise above it and be able to really do extraordinary things under extraordinary circumstances. So with that, it's really my great pleasure to introduce Dr. Michelle Berry, who is the outgoing chair of CUGH from Stanford University. And she's going to introduce two of our signature awards this year. Dr. Berry, over to you.
Thank you, Keith. As Keith mentioned, I'm the Dean of Global Health at Stanford University and chair of the board of CUGH. And it is my extreme pleasure and honor to present this year's Distinguished Leader Award. This award is given to an individual with lifetime outstanding leadership skills in his or her field, resulting in significant, lasting benefits for global health outcomes, particularly for the world's poor. He or she should have inspired excellence amongst peers and staff and be well respected in the global health community, nationally and internationally, as well as having played a pivotal role in advancing the health of the global health community, and also the health of our planet. This year, we actually had two individuals who tied for assignation of this award. Our first recipient is Dr. Harriet Mayanja Kiza, a professor of medicine and former dean at the School of Medicine at Makerere University in Uganda, and who really has diverse contributions to global health education, and which has created worldwide impact. Over 30 years, this trailblazer in women's leadership rose from lecturer to chair in internal medicine, and later dean of the School of Medicine at Makerere University. She's the first woman to have ever held this position. She's co-founded programs such as the Makerere University-Yale collaboration, or what we call MUU, which I've had the pleasure of collaborating with her for years. This program emphasizes bi-directional training and mentorship programs benefiting trainees and faculty from Uganda and the US. She also co-founded the Bellagio Global Health Education Initiative, which brings together members from 5 continents to promote the equitable implementation of evidence-based global health curriculum in diverse settings. Today, she remains a role model for fostering female leadership and retaining healthcare workers in Uganda. Harriet, congratulations for this well-deserved honor. Do you want to say a few words?
Thank you. Thank you, Michelle. Briefly, I was introduced to global health and global health education as a departmental chair over 20 years ago, and I quickly noted the benefits as well as challenges related to cross-training and interaction of Ugandan healthcare students, residents, and faculty with those in other countries. The initial exchanges with various countries were North America and Europe, and later with Africa, where we developed South-South training and research activities with counterparts in various African countries. Over the years, we have trained, learned, shared, and forged friendships and partnerships, not just in medical education, but with colleagues from different healthcare disciplines, all with one overarching goal: better health for all people and populations in our countries and globally. We've demystified various notions, beliefs, and dogmas, and over time worked together towards better global health outcomes, students and healthcare workers from both high-income countries and low-middle-income countries, global North and global South coming together, realizing that we all had something we could teach and learn from each other in these exchanges and interactions. We quickly realized the need and benefits of bringing students and female professionals together, the next generations of the vanguards of health, to talk to each other, listen, learn, discuss, agree and disagree, to break down barriers, be they social, economic, ethnic, religious, age-related, or just different backgrounds, working together for a common goal of better health for all. Even students from different parts of the world have something to learn from each other and to teach each other. A student from Uganda, back from a US elective, proudly saying, I showed those students how to examine for the spleen, confident of our clinical skills taught in Uganda. A Uganda resident teaching others back home from his elective in the US on the merits of evidence-based healthcare practices, brandishing his income pilot and showing how it shows. A visiting student from a high-income country, impressed by the resilience and innovativeness of Ugandans and low middle-income country professionals as a whole, towards maximizing patient care benefits within our resources and limitations. And over time, our professionals inviting colleagues in Uganda and other African countries as a whole.
Harriet, I think we can't hear you anymore. Cole, our tech support, can you help her?
In addition, this interaction, is that better?
Yeah, a little bit better.
In addition, this interaction has opened our eyes to the principles of interprofessional education as different providers of health learn outcomes, each with a niche, each person playing a key role in health outcomes. Overall, global health education brings together the future healthcare providers, practitioners, leaders, planners, policymakers, all key players in global health, demystifying their differences and working together for improved global health equity and outcomes now and in the future. Global health and global health education is not all about resources or lack thereof. It's not all about those who have practiced first and the newcomers, but working together across the globe, each doing their best for the good of their people and communities with an ultimate goal of health equity and improved health in persons in our spheres and beyond. During the COVID-19 lockdowns, some Ugandan and US students had a fruitful virtual training interaction where even we trainers learned something from the students, impressed by how easily these students who had never met able shared and discussed some key issues in global health, and some went on to form their own programs of continued virtual interaction. I want to thank all the colleagues I've worked with in the different countries and continents in various aspects of global health in Africa, including Kenya, Tanzania, Ethiopia, Rwanda, Gambia, Malawi, South Africa, Namibia, Egypt, Zimbabwe, and Zambia. In Asia, friends in China, India, Philippines. In the US, multiple friends, and in Canada. In the UK, and different countries in Europe we have worked with, Netherlands, Germany, Belgium, Sweden, Switzerland, and even in Australia, we had a successful geriatric training mentorship program. And I thank you all partners in this. Lastly, a big thank you to CUGH for this award, which means a lot to me. The last CUGH meeting I attended in New York, I self-funded because I wanted to attend the meeting. And I slept in a small hostel with shared shower rooms. I hadn't done that for years. New York is expensive. All because I believe in the principles of the Consortium of Universities for Global Health, of supporting and bringing together training institutions and partners across the globe towards improving the well-being of people on our planet through various global health activities. And as I accept this award, which I'm very excited to take, I thank you all for this and the various who have worked together with over the years. Thank you.
Thank you, Harriet. Now I'd like to recognize and congratulations, Harriet. Now I'd like to recognize our second recipient of this honor, Dr. Jim Teals. Dr. Teals is the chair of the Department of Global Health at George Washington University, as well as adjunct professor at the Department of International Health at Johns Hopkins School of Public Health. In the words of his nominator, Dr. Adnan Haider, Dr. Teals exemplifies, quote, the accomplishments and commitment of a truly outstanding individual who has contributed enormously to the advancement of global health worldwide over the past 30 years. He has demonstrated exceptional leadership in epidemiologic research, as well as service and advocacy, particularly in the areas of child health, maternal health, nutrition, and community health. His research, from work on eye diseases and vitamins to large-scale trials of micronutrients in Nepal, has led to significant improvements in key health outcomes, particularly in low-income countries of South Asia. Dr. Teals has inspired methodologic excellence for decades in his peers, students, and research staff within the United States and internationally. Jim, it is an honor and a pleasure to know you and to present you with this recognition of your decades of contributions to global health.
Thank you very much, Michelle. This is quite an honor, certainly an unexpected one. I have to say that for many, many years, I bemoaned the fact that there was never a kind of a go-to meeting for the global health community. And CUGH has really filled that role over the last 10, 12, 15 years. And it's been a privilege and an honor to be able to both attend those meetings, meet our colleagues, and discuss important issues in this arena. Well, you know, while these awards are always given to individuals, they really reflect what we do as teams, right? So none of what either I have accomplished or most of us have accomplished, quite honestly, could be done by ourselves. It's really the opportunity to work with other fantastic members and colleagues, both domestically and internationally, in much of our research and advocacy work around the world. And I just want to acknowledge the fact that it really is the teamwork that makes it all worthwhile. Sometimes, you know, sometimes those of us lead those teams, and other times we're just members of an important group of multidisciplinary individuals who are applying themselves to important public health problems globally. So thank you very much. It's quite an honor and a surprise. I greatly appreciate this honor, and I certainly wish the CUGH every opportunity for additional great work in the future. And I really look forward to us all getting together in person again sometime in the next couple of years. So thank you so much again, Michelle.
Thanks, Jim. I'm going to turn this over to Keith Martin, the Executive Director of CUGH.
Thank you very much, Michelle. And again, congratulations, Harriet and Jim. We're obviously, as Michelle mentioned, we're really honored that you won, and congratulations really on winning this award and all of your great work. So the next group that we're going to introduce are CUGH's Mid-Career Leadership Award. And as the name goes, it's for individuals who are earlier on in their career. And the first winner that we have in the Mid-Career Award is Dr. Nadia Sam Agudu. Dr. Sam Agudu is at the Institute for Human Virology at the University of Maryland School of Medicine in Baltimore. She's also at the Institute of Human Virology in Abuja, Nigeria. Dr. Sam Agudu is a Ghanaian-born clinician scientist who received her MD from the Mayo Clinic in Rochester, Minnesota. She completed her pediatric residency and infectious diseases fellowship at the University of Minnesota Medical School. She then spent 2 years as a consultant pediatrician in infectious diseases in immigrant, refugee, and travel medicine at Merit Care in Fargo, North Dakota. And in 2010, she joined the Institute of Human Virology at the University of Maryland, where she's currently an associate professor of pediatrics. She's based, though, full-time in Abuja as a senior technical advisor for pediatric and adolescent HIV at the Institute for Human Virology. And her work involves public health program implementation in pediatric and adolescent HIV, teaching and mentoring students, trainees, and early investigators, and conducting research in Nigeria and other African countries. Dr. Sam Agudu's research focuses on implementation science in the prevention and control of major infectious diseases affecting African children. And she has led malaria, TB, HIV, and COVID-19 studies funded by sponsors, as you can see on this slide. She's also a member of the WHO technical working groups on HIV treatment and service delivery for children and adolescents, and is a member of the NIH Adolescent HIV Prevention and Treatment Implementation Science Alliance, and leads the Central West African Implementation Science Alliance. So Dr. Samu Gudu, congratulations on winning our mid-career award. Now we have a couple of other awardees also in this career, and the next one is to Dr. Rachel Iduwu. Dr. Iduwu is the CDC branch chief in adult HIV care and treatment. She's a commander, a commissioned officer in the United States Public Health Service, and began her role as the branch chief for HIV care and treatment in the CDC country office in Maputo, Mozambique. Prior to this, she served as a technical advisor to the African Centers of Disease Control and Prevention, Africa CDC, to establish the surveillance and response unit and 5 Africa CDC regional collaborating centers, extremely important work. She's mentored 10 African epidemiologists through the really interesting Africa CDC, at the Africa CDC, through the US CDC supported fellowship program. And she has served as a medical epidemiologist within the US Center, US CDC National Public Health Institute program. And in this role, she guided African ministries of health in Liberia, Ghana, and Zambia, and in each country established a nationally integrated platform for public health delivery. In addition, she spent over 6 years of global public health experience responding to public health emergencies and health system strengthening, including 2 years as an epidemic intelligence service officer during missions in South Sudan, Chad, Tanzania, and Ethiopia. She has served as an epidemiologist in Liberia as part of the US CDC's Ebola response. And prior to the US CDC, she completed a US National Institutes for Health Fogarty Research Fellowship in Nairobi, Kenya. And her undergraduate medical and graduate studies were completed at the University of California, Berkeley, University of California, San Francisco, Vanderbilt, respectively. And her residency training is in general surgery and critical care medicine that took place at Vanderbilt. So Dr. Iduwu, congratulations on winning a 2022 CUGH Mid-Career Leadership Award. The final winner of the Mid-Career Leadership Award, we had 3 winners because these 3 outstanding individuals tied, is somebody well known to CUGH, Dr. Ashti Dubi Prasad. Dr. Dubi Prasad is the co-director of the Institute for Global Health Center for Global Health Education in Chicago, Illinois. She is an associate professor of medicine in the departments of medicine and medical education, and is the co-director for the Center of Global Health Education at the Institute for Global Health. She's the founder and director of the McGaw Global Health Clinical Scholars Program for graduate medical trainees, faculty director for the Online Masters of Science in Global Health through the School of Professional Studies, the Global Health Elective Director, and one of the leaders in the Health and Society curriculum of Northwestern University's Medical School. She has been an active and vigorous and wonderful member of CUGH's education subcommittees, working tirelessly to deliver a lot of important products that the subcommittees deliver, and has led quite a number of them. And she has become, in her own right, an international expert in global health pedagogy, particularly in the work in ethical practice and competency-based curriculum development. And at CUGH, we have a competency-based toolkit that you can find online, and Dr. Dubi Prasad was fundamentally important in delivering and creating that. She's now collaborating with international partners to support locally driven learning and training with academic partners around the world. And current partnerships include interprofessional training and development in palliative care and pediatric emergencies. So Ashti, congratulations on winning our Mid-Career Leadership Awards. So to all the 3 winners from all of us at CUGH, really, congratulations for winning, and I hope we'll see each other in person when we meet in Washington, DC next year. The next set of winners are our Young Leader Awards. And this is a way for us to honor those who are early on in their career. But as you'll see from this group of extraordinary young people, our future is looking very, very good because they're all done really extraordinary things early in their career. The first winner is Dr. Dale Barnhart. Dr. Barnhart is the Global Health Equity Research Fellow at Harvard Medical School. She is an epidemiologist whose research focuses on program implementation and evaluation in low-income settings. She's a postdoctoral research fellow at Harvard Medical School and has lived full-time in Rwanda since 2019, embedded as a researcher within Partners of Health in Nshuti mu Buzima, where she conducts research related to HIV and viral hepatitis. And she promotes global health research equity by training and mentoring Rwandan researchers. She also provides methodologic leadership and research mentoring to the PIH's cross-site COVID-19 cohort research network, which coordinates across partners and health sites in 8 countries. And I know all of us have heard how heartbroken we were on the passing of Dr. Paul Farmer, and I know Dale, this would mean a lot to you, to be sure. And Dale, so you're online there, we can see you. From all of us at CUGH, congratulations, Dale, on receiving this award. The next winner is Mr. Sidesh Zadeh. Mr. Zadeh is a research aide at the Division of Surgical Sciences at Duke University. And he is, as I said, a research aide, and he's the co-founding director of nonprofit research and advocacy at the Association for Socially Acceptable Research, ASAR, and completed a Bachelor of Science, a Bachelor of Science, Master of Science dual degree program at the Indian Institute of Science Education and Research in Pune in 2018, and worked at Harvard with Dr. Alvaro Pascual Leon on non-invasive brain stimulation markers for cognitive decline in Alzheimer's disease. He completed a second master's from Duke, working with Dr. Joao Visochi on mapping surgical care access in rural India, and at ASAR focused on systems modeling to investigate socioeconomic disparities, healthcare access, and population-level mental health care problems. At Emergency Medicine Division at Duke SOM, he co-led the BASS Connections team with Dr. Catherine Staton and Dr. Visachi, investigating cultural variations in alcohol use behaviors. And he's worked with Dr. Tamara Fitzgerald on improving access to gasless laparoscopy in low-income countries. He is a member of the Indian Academy of Pediatrics COVID-19 Task Force for School Reopening, and he's currently a fellow of the Lancet Citizens Commission on Reimagining India's Health System, working with the Human Resources Workstream. And he's part of the Global Burden of Disease Collaborators Network on Mental Health Innovation Network and Global Mental Health Action Network. So, Mr. Zadeh, congratulations to you on winning one of CUGH's Young Leader Awards for 2022. The next winner, and there are 5 in total, which shows you how superb the quality of individuals were this year, is Ms. Anusha Jairam. Ms. Jairam is the Global Surgery Research Associate in the program in Global Surgery and Social Change at Harvard. She's a 4th-year MD, MBA candidate at Tufts, born in Singapore, raised in Australia, and attending high school in Ohio. She went on to attend New York University for a BA in anthropology. And in college, she competed on the Taekwondo team and was a resident assistant to first-year students. She spent a summer working at a public clinic in Peru. After NYU, she worked for 2 years as a clinical research assistant at the Department of Surgery at Mount Sinai Hospital in New York City, and served as an emergency department advocate for survivors of sexual assault and intimate partner violence. In medical school, she pursued her interest in public health and surgery through a commitment to global surgery research, education, and advocacy. And she served first as the Vice President of Research and then the National Co-Chair for the Global Surgery Student Alliance, supporting students and trainees interested in global surgery. She also spent a year as a Paul Farmer Global Surgery Research Associate at Harvard, and worked on projects in global trauma, access to blood, financial risk protection, and anti-racism and equity. She has served as a regional lead and junior advisor for Gender Equity Initiative in global surgery, and on the advocacy committee for the Association for Academic Global Surgery. She is currently applying for general surgery residency and plans to pursue a career in academic global surgery. And Anusha, I hope you join our global surgery work that we're doing at CUGH. Please contact us. We'd love it if you could join our global surgery group. People, we have surgeons around the world working on this, including Dr. John Mira at Harvard. And the next winner of our Young Leader Award is Mr. John Ebong. Mr. Ebong, who, thank you, John, for being present at some of our conference, is the president of Health Compass Initiative in Nigeria. He's a young reformer and a global health advocate, passionate about health promotion in low and middle-income countries, and is a coordinator, was a coordinator for the Dignified and Non-Discriminatory Healthcare Program of the International Federation of Medical Students Associations, IFMSA, which many of you know. That was in 2018, where he coordinated advocacy to ensure universal health coverage and equity in healthcare, especially amongst vulnerable groups. He's represented IFMSA at the 72nd World Health Assembly in Geneva, where he advocated for meaningful youth involvement in health decision-making. He founded Health Compass Initiative in 2017, and that's an NGO that tackles NCDs at a grassroots level in under-resourced settings, ensuring prevention, early detection, and control of NCDs. And since its inception, NCI has reached an incredible 16,524 people with education regarding prevention of NCDs and offering free NCD-related screening services to 4,831 people, resulting in improved quality of life, particularly in indigent communities. Every year, the organization offers free NCD-related screening to over 1,000 people and partners with reputable organizations for the prevention and control of NCDs. And under his leadership as president of HCL, HCL was inducted as a member of the NCD Alliance, which is a partner of the UN, and has become a leading voice for NCDs in Nigeria. The organization received a commendation from the director of the Department of NCDs of the WHO and made a live address at the HCL annual summit, acknowledging and endorsing the immense work within the organization. He's passionate about the use of policies to combat NCDs within resource-poor settings, and aspires to be a public health physician and health policy maker. Congratulations, John, well done. Finally, our last but not least Young Leader Award is Ms. Leah Pierre. Ms. Pierre is a fellow of the Anne C. Carter Global Health Fellowship at the American Medical Women's Association. Leah is a medical student at St. James School of Medicine, taking a Bachelor of Science specialization in biology and a minor in human rights, graduate from Concordia University, and the recipient of the Anne C. Carter Global Health Fellowship. Through her interactions with vulnerable patient populations in Canada, Costa Rica, South Africa, and Anguilla, Leah has been involved in local and global humanitarian projects, ensuring the provision of medical care for underserved communities around the world. She's also the founder and the executive director of the Pure Medical Foundation, an aspiring youth-led international not-for-profit organization advancing health equity, diversity, inclusivity, and racial justice in medicine. Her work is centered on allyship as a framework to pursue change, to ensure more inclusive and equitable healthcare for all. And her aim is to become a diverse, committed, and compassionate leader in public service as a global health changemaker, human rights advocate, and physician in caring for life. And I think those last few words that apply to you, Leah, is something that all of our winners would share. So I think if you put your hands together virtually, please congratulate all of the winners for this year's Mid-Career and CUGH Young Leader Awards. Congratulations to one and all. Well done. The next award is a bittersweet moment because we lost somebody very dear to all of us in global health. And for that, I'm going to turn it over to our friend and colleague, Dr. Elsie Kaguli Malawadi. Dr. Malawadi is an extraordinary African leader on the continent of Africa and indeed around the world in health. She's going to be taking over the helm, the presidency of the African Forum for Research and Education and Health this summer, as Dr. Abigail Kazembe steps down. And Dr. Kiguli Malawadi is going to talk about this next award and the winner of the award. And the award is in the name of a very good friend of ours who we lost this year, Dr. Hakeem. So Elsie, please take it away. And we'll turn off the slides shortly.
Thank you, Keith. As you've heard, I'm Elsie Gulimarade. I'm the Vice President of the African Forum for Research and Education in Health, AfriHealth. It is a great honor for me to present this award in honor of Professor James Hakim. Professor James Hakim will be remembered through an annual award which has been established in his name, supported by the African Forum for Research and Education in Health, AfriHealth, the Consortium of Universities of Global Health, CUGH, and the Fogart International Center at the US National Institute of Health. Professor Hakim lived between 1954 and 2021. He was an acclaimed researcher and professor and a profoundly important leader in advancing medical research and education in Africa. He was the chair of the Department of Medicine at the University of Zimbabwe in Harare, a founding member of AfriHealth Governing Council, a member of the esteemed partner to CUGH, and a long-standing prominent grantee of the Fogart International Center. Professor Hakim studied medicine at Makerere University, Kampala, Uganda, and went on to specialize in internal medicine at the University of Nairobi, Kenya, and the Royal College of Physicians, UK. He went on for further specialization in Germany, in Australia, and the University of Cape Town in South Africa. He was an active clinician with interest in HIV/AIDS preventive and therapeutic research, including co-infections. He was a member of the Conference of Retroviruses and Opportunistic Infections Committee and was a committee member of the Glasgow HIV Therapy Conference, International Conference on AIDS and STIs in Africa, and HIV Interest Conference. He was a member of the Governing Council of the International AIDS Society. He maintained successful collaborations globally with the US, UK, continental Europe, and had many African partners in research and capacity development. He had more than 150 publications in internationally referred journals. He was the principal investigator in several NIH research capacity building grants, in which his mentorship skills remain valued by both junior and senior faculty in the University of Zimbabwe and beyond. He was an excellent teacher at both undergraduate and postgraduate level. He held postgraduate diploma in health professions education from the University of Cape Town, South Africa. And we had many discussions over this as promoters of health professions education in Africa during the Medical Education Partnership Initiative. And here with us, Peter Kilmax and Michelle Barry also had long periods of collaboration with Professor Hakim and many others on this panel. So each year, the James G. Hakim Award will provide an African health trainee or early career health professional with funding to cover registration and travel to the annual CUGH meeting, where they will be recognized for their achievements. Applicants will compete for the award by submitting abstracts to the CUGH Scientific Committee. To be eligible, they must be a citizen of an African country with primary professional affiliation with an African-based institution, and currently enrolled in a degree granting education program from an accredited African university, or have no more than 5 years from receiving a terminal degree. So the inaugural award is to be given this year, 2022. I'm so delighted that this year the James G. Hakim Award goes to Roy Gonzaga Mubuke from Makerere University, Kampala, Uganda, a brilliant young gentleman who happens to be my former student and mentee, with whom we share a passion to improving health professions education in Africa. Roy, congratulations, and you deserve this prestigious award. Thank you. Over to you.
Thank you very much, Dr. Elsie. I'm so delighted to receive this inaugural award, the Professor James Hakim, a Global Health Award, in recognition of his tremendous work he has done in the transformation of health professions education in Africa. I would like to acknowledge AfriHealth, CUGH, Fogari International Center, the National Institutes of Health, for supporting this award and recognizing the works of Professor James that he has done, through whose hands many people have gone and have gone on to succeed in their various professions and in various settings where they are. So through this award that has been given to me, the inaugural award, I would like to humbly accept it and promise that I will use this award to continue the good works that Professor James Hakim desired in the region and globally, and also to continue the mentorship desires that he had to transform medical education on the continent. I would like to thank my family and dedicate this award to them. My mentors, some of them are here, onto his shoulders that I'm standing today. And lastly, to all the mentees that went through Professor James's hands, wherever they are, and we promise that we shall continue the good works and the desires that he stood for. Thank you very much once again for this award, to AfriHealth, CUGH, and NIH, Fogari International Center for supporting this. Thank you so much, and I accept the award. Thank you.
If I may, Dr. Mabuki, I just want to add my congratulations on behalf of the Fogarty International Center, and note that it's especially fitting that your winning abstract was about your implementation of the Professor James Hakim Leadership Program in Uganda. So we're very happy at Fogarty to partner with CUGH and AfriHealth in sponsoring this award. We congratulate Dr. Mabuki.
Thank you very much. Thank you very much, Elsie and Peter and Roy. Congratulations from all of us again on your award. And we were obviously crushed when we heard of the passing of Dr. Hakim as a result of COVID. But at least in this way, we can continue to honor his presence. And I'd like to thank Dr. Kuguli Malawadi and Dr. Peter Kilmarks for your leadership in enabling this award to take place to honor our friend, Dr. Hakim. The next award is an annual award, a set of awards that will be presented by our friend and colleague, Ms. Zoe Mullen. Ms. Mullen is the editor of the Lancet Global Health, a CUGH board member, and she has been a tireless supporter of these awards for many years, and frankly, an incredible leader in working with our colleagues in LMICs to provide space and opportunities for them to present their research and share it widely. So Zoe, thank you again, once again, for allowing these awards to occur, and I'll hand it over to you.
Thanks so much, Keith, and thank you all for having me again. As Keith said, it's I don't know how many years now we've been presenting these awards, but it's always such an honor to be able to look at some of the work of our upcoming global health scholars of the future, and to be able in some small way to recognize the great work that is going on. Without much further ado, I'm going to announce the winners in the tracks as you see here. These winners will be receiving from us a nice certificate, but also a check for $500. So congratulations to all the winners for that. So here we go. In the Social Determinants of Health track, with a poster entitled Breast Cancer Incidence and Predictive Parish Level Social Determinants of Health in and around Kampala, Uganda. The winner is Rachel Weber from the Medical College of Wisconsin. So congratulations to Rachel and your team. In the Communicable Diseases track, for a poster entitled Willingness to Use Different HIV Pre-Exposure Prophylaxis Delivery Modalities Among Ghanaian Immigrant Women in the US. The winner is Gloria Idu Frimpong from the University of Buffalo. So congratulations, Gloria. In the Global Health Education track, the poster is entitled Global Health Narrative Medicine Elective as a Tool for Improving Cultural Competency. And the winner is Irene Suing from the University of Vermont. So congratulations, Irene. In the Non-Communicable Diseases track, the poster is entitled Completeness of Medical Records of Trauma Patients Admitted to the Emergency Unit of a University Hospital in Upper Egypt. And the winner is Yassin Saleh from the University of Illinois. Congratulations, Yassin. In the Planetary Health track, the poster entitled Assessing the Impact of a Community-Based Lymphedema Management Program Using Clinical Staging and Quality of Life Measures for Podoconiosis Patients in Rwanda. The winner is George Mkondo from the University of Global Health Equity in Kigali. Congratulations, George, to you and your team. In the Human Rights track, for the poster entitled Women's Contraceptive Autonomy in Rural Northwest Tanzania, the winner is Sheridan Bowers from Weill Cornell Medicine. Congratulations, Sheridan. In the Strengthening Health Systems track, for the poster entitled Determining the Clinical Efficacy and Cost Effectiveness of Telepsychiatry in Resource-Constrained Environments and Refugee Populations with Mental Health Illnesses, the winner is Kareem Sharif from the University of Illinois. Congratulations, Kareem. And finally, in the Translational and Implementation Science track, the poster entitled How Does Scientific Evidence Translate into Policy Development in Low- and Middle-Income Countries, a Scoping Review of Theories, Frameworks and Constructs. The winner is Kristen Danforth from the University of Washington. So congratulations to everyone. I'm really sorry I can't be there in person to hand over your awards. It's always such a delight to do that. But hopefully I can meet you another year when we're back in an in-person conference. So congratulations to everyone again, and your check and your certificates will be in the post to you as soon as possible.
Thank you very much, Zoe. And again, first to all of the winners, congratulations again from all of us at CUGH. And a big thank you once again to Zoe Mullen, as the editor of the Lancet Global Health, for your support of this annual set of awards for best student posters. And I would encourage you to take a look at Zoe annually provides sessions at CUGH on how to get published. And she did one today. You can take a look at it on the program. So please take a look at Zoe has been works tirelessly to train people on how to get published, how to write better in a better manner for getting your material into research journals. And I'd encourage you to look at the Lancet Global Health and the Lancet family of journals, which are open access. And it's really a go-to place for information and cutting-edge research on global health. Thank you, Zoe. The next set of awards will be delivered by a good friend of CUGH's, Dr. Anwar Velji. Dr. Anwar Velji and his wife Pari Velji created the the Velji Family Foundation, which annually celebrates global health, education, research, and service by honoring individuals and projects that demonstrate creative approaches to serving underserved populations. And Dr. Velji, he was one of the founders, in fact, of CUGH, and annually has been extremely generous and kind and gracious in funding these awards every year in the 4 categories. So Anbar, it's wonderful to see you. Thanks again to you and Pari for your very wonderful generosity in supporting these awards and even creating a greater number of awards this year so more people can be honored. Anbar, I will turn it over to you.
Thank you very much, Keith, and I really would like to thank you from the bottom of our hearts for the amount of work and support that you have given us. And I also want to convey our thanks from my wife, Pari Velji. And I would also like to thank Dalal Najar and Jenna and Julia for doing outstanding work and help with the awards. So thank you, Dalal and others. And moving on to the winners of the 2022 Velji CUGH Awards for Global Health Excellence. We will start with the first set of awards, and this is for the teaching excellence in global health. And the winner for 2022 is Dr. Desai. Mayur Desai is currently at Yale as an Associate Dean of Diversity, Equity, and Inclusion. This was the first or inaugural dean at that university. But he's been very active in several arenas prior to that and in several countries. Dr. Desai is being recognized for his teaching excellence and leadership roles over several years, both in the US and 6 African countries, including Ethiopia and the Sudan. He has been a champion for diversity and equity, and Dr. Tedros Adhanom, then Ethiopian Minister for Health, now Director General of WHO, had high praise for him and his work in improving health for the people of Ethiopia. It is our great honor to present him with this year's award for teaching excellence. Congratulations, Dr. Desai, and congratulations to your family. We always have to remember our families because they sacrifice a lot for us. And congratulations again. The next award is for the Young African Leader Award. And the winner this year is Joanne Egby. Joanne is a dental student at the University of Ibadan and is being recognized for her public health championship and advocacy for community education regarding health prevention and promotion, especially regarding oral health and avoidance of unhealthy habits and superstitions. The next award is in the Faculty Leadership Award, and Dr. Jerry John Newtor is being recognized for his several roles, including founding the Africa Interdisciplinary Health Conference in 2018 to connect several health programs and healthcare workers to promote health equity and high quality healthcare. He has been involved in several other programs, outstanding research and innovation. He's very passionate about encouraging more men to go into nursing, and I hope everybody will support that notion, since it cannot be very unisexual type of a profession. We need all type of people there, especially in these hard times and crises. Congratulations to you, Jerry, and congratulations to your family for winning this award. The next award is for Dr. Shadi Saleh, and he's being recognized for his several contributions to global health education, including an exemplary model and he epitomizes the leadership, ingenuity, and innovative spirit. As somebody who wrote a reference for him said for this award. Being the founder director of Global Health Institute at the University of Beirut is indeed a high achievement, and especially in the Middle East. And we hope that there'll be more of such centers of excellence in the Middle East. He was also a member of the Lancet Commission on Syria and has developed and worked with WHO, World Bank, and has been an advisory for healthcare financing and so on. Congratulations, Dr. Saleh, and we hope you'll get more engaged with CUGH as well, and CUGH with Lebanon and the greater Middle East. The next awardee is Dr. Majid Sadid, who's the Director of Global Health Program at Nuance Health and the University of Vermont. He is recognized for his outstanding contributions, including innovation, decolonization in his programs, bidirectional programs with a center of gravity, emphasizing the host partners, and also capacity building. We would like to congratulate Dr. Sadid for your excellence in global health, and congratulations to your family. The next awardee is Dr. Karen Ulster, and she is being recognized for her 23 years of leadership and dedication of global health innovation projects in several African countries: Nigeria, Mali, Kenya, Tanzania, Nepal, and Guatemala. She has also worked tirelessly creating modules, teaching collaborations at her home institution and at the Northwestern Medicine. And please congratulate her, and congrats to your family. Moving on to the Student Leaders in Global Health Award for 2022. You will see Leah Pierre mentioned here again, but she has already won another award, as has been discussed previously. So we will move on to Helena Franco. Helena Franco is being recognized for her several contributions to the field of global surgery, development of AI platforms to help the underserved populations, and development of modules, e-learning systems, and student surgical networks for advocacy and research. She has had high praise from the surgical departments of many countries. Congratulations to you, Helena, and congratulations to your family. Our next awardee is Sylvia Ramos Diaz. She is being recognized for her work with the Hispanic community in the program HOPE, which is Health and Oral Health and Prevention and Education. She, with her colleagues, provide free care for prevention and promotion of oral care, dental care for the marginalized communities in and around where she lives. She has been recognized and praised previously by the American Dental Association for her work. I look forward to seeing her when she is a full practitioner and she joins the greater community of global health. Congratulations, Sylvette, and congratulations to your family. Our last awardee is Aditi Sivakumar, and she's being recognized as a philanthropist advocate on behalf of women. She has developed and distributed several health prevention and promotion materials within different communities in Canada and focuses on women's health. She has been very active in preventing violence against women, especially during the pandemic, and continues to follow them afterwards in the community. She has also developed several platforms for empowerment of women. Congratulations to you, Aditi, and to your family. Looking forward to greater things. And thank you all again for the support we have received. Thank you.
Thank you very much, Dr. Velji. And again, from all of us at CUGH, once again, to you and Pari, you really, year in and year out, your generosity is really remarkable in financially supporting these awards and honoring leaders in the 4 categories. It means a lot to the winners. It means a lot to us. So thank you very much for your really extraordinary generosity and ongoing support for CUGH and these awards. Thank you, Anbar.
Thank you so much, Dr. Martin.
The next award is one we started a few years ago, and it's the Neglected Stories in Global Health Award, and it's sponsored by Global Health Now and CUGH. I would encourage you to take a look at Global Health Now, based at Johns Hopkins University. They put out a daily report on global health, and the individual who is helping to lead that with Brian Simpson as Dana Kurtzman-Myers, and both Dana and Brian work tirelessly at Global Health Now to bring the stories of the world to everybody. So Dana, please, I'll turn it over to you to honor this year's award of the Global Health Now CUGH Untold Stories in Global Health. Thanks, Dana. Over to you. Dan, I think you might be muted, so if you can unmute, that would be great.
Yeah, I'm not muted. I'm not sure. My camera isn't converting. I still see yours. I'm not sure if anyone can see me.
Yes, we can see you, Dana.
Oh, you can see me. Okay, I'm sorry. Well, so thank you very much for the introduction, Keith. And yes, I'm Dana Kurtzman-Myers, and I'm managing editor of Global Health Now. And it is my honor to present the winner of an award that truly embodies the spirit of CUGH by spotlighting and giving a platform to underreported stories in global health. And it's the Global Health Story Contest of 2022. And I just would like to thank CUGH for, I think, 8 years now of partnering with us to create this opportunity to raise awareness about important issues in global health. And we'd also like to thank the dedicated readers of Global Health Now and our donors whose generous support makes it possible for us to send a journalist to report on the winning idea each year. So with that, the winner of this year's contest, I'm very pleased to announce, is Rupal Thakur, and she is the executive director of Zana Africa in Kenya. And so here is her entry in her own moving words as she submitted it to our contest. For many adolescent girls globally, puberty is the most vulnerable time of their lives. They face myriad challenges that derail their education and safety, perpetuating cycles of poverty. Entrenched social norms, normalization of gender-based violence, female genital cutting, etc., amplify the risk. Such pressures are insurmountable without knowledge of bodies and rights, but these issues are not well addressed by schools, families, or communities. And when adolescents are denied rights-based, factual, and culturally appropriate answers to questions about reproductive health, rights, and decision-making, they lack agency and cannot protect themselves. The consequences are dire. In Kenya alone, 40% of 19-year-olds are pregnant or childbearing. The average age of first sex is 11.7, and 92% of those encounters are unwanted. Zana Africa worked with communities across Kenya to co-create a 16-month program addressing these issues. Evaluated through a randomized control trial, this work has transformed gender norms, empowered girls, and truly changed life outcomes. So we are looking forward to sending a journalist or enlisting a journalist in Kenya to tell this story and give it the spotlight that it deserves. And we would just like to thank Rupal Thakur for sharing this critically important issue. And we'd also like to thank all of our friends at CUGH for supporting this effort. So thank you all.
Thank you so much, Dana, to you and Brian. And I would encourage those of you here to please take a look and sign up for the Global Health Now bulletin that comes out on a daily basis. Dana and Brian worked tirelessly to put that together. And just to know that there were 98 submissions for the Untold Stories in Global Health competition. And in the past, some of these stories have gone on to have consequential impacts globally. The fact that they were highlighted through this mechanism enabled them to have international attention that would not normally receive the attention it should, and it changes lives. And this one, when we were going through it, frankly, struck us because it was not only applied to Kenya and the really profoundly horrible situation that adolescents and young girls and child girls are faced with in terms of sexual assault, early marriage, but it is a global problem. And I'm just really thankful, Rupal, for you sharing this with us. We're so happy you won, and we certainly look forward to shining a sharp light on this with your help and with the help of others. So thank you, Dana. Thank you, Brian, again, for being such a wonderful partner in the Untold Stories in Global Health competition. The next award has been going on again for, it's another one's going on for a decade. And this is the Reflections competition. And we're going to have Ginny McCarthy, who she's the Master's of Divinity doctoral student at Colorado School of Public Health at the University of Colorado. She's going to announce the winners of the essays this year. And so I'll turn it over to Ginny, and I want to just thank Jessica Evert, Dr. Evert. She was one of the original people who started this, along with the Bui, and really thank you for continuing to support this effort. And Dr. Evert is the Executive Director of Child Family Health International, and Bui is at I believe, Loyola University. Anyway, back to you, Ginny. I'm going to turn it over to you to announce this year's winners.
Excellent. Thank you, Dr. Martin, for your introduction, and thank you to CUGH for the opportunity to continue to hold this annual reflective essay contest. As Dr. Martin mentioned, I'm Ginny McCarthy. I'm one of the 3 members of the Essay Oversight Committee for this annual contest. And on behalf of Dr. Tui Bui and Dr. Jessica Evert, we would like to thank the committee and also the judges who evaluate the essays each year, and to all those who submitted essays for the contest. This year, 2022, is the 10th year of the Reflective Essay Contest. We've received hundreds of essays over the years, and it is truly a privilege to read and spend time with each of these essays. These essays, the product of skillful reflective practice, are sincerely unique in their capacity to simultaneously bring diverse global realities and elements of our shared and precious humanity together. These ways that we see our humanity intertwined are both familiar and new, inspiring and challenging. I would like to extend my sincere gratitude and congratulations to the winners for their submissions and to the honorable mentions of the 2022 CUGH Reflection Essay Competition, and recognize each of these talented and thoughtful essayists now. We have 3 winning categories, as you can see here below. You can see the first category we'd like to recognize is the essay by Lusayo Mwakatika, Finding Meaningful Connection Through Problems. And this is the winning essay from the trainees from lower middle income countries. The second category is the trainee category, and this could be anywhere from undergraduate to postgraduate trainees. And our winning essay is from Jean Adumfe, and her essay is entitled Enlightened. And from our faculty practitioner category, the winning essay was entitled A Radical Act, and our author is Mitra Sadik. You can see on the right, we have 5 honorable mentions. Dr. Bethany Hodge submitted an essay entitled Worth 1,000 Words. Rania Mansour, her essay was entitled A Home for Hope. Jet Choquette submitted her essay entitled Human Experience Shaping Medical Needs. Jehanaz Dastur, Impetigo, A Case Study. And Huda El-Zain, The Earth in You, Weaving Foundations in Global Health. So thank you again to these authors for their outstanding work, their reflection in global health highlighted through these 1,000 words. Thank you to CUGH for continuing to host this essay contest. And thank you to all who attended the session yesterday. And if you were not able to attend, The authors read their essays in this session. You can find this through the CUGH program. You can also find the winning essays online. And finally, there's a publication coming out with the past 8 years of essays, which will be released this summer. So you can take a look for that coming up in the future. Thank you again.
Thank you so much, Ginny, and please give our thanks to Jessica and Bui for again your collective support for these awards. As you said, it's 10 years they've been going on, and when we meet in person, it's really inspiring to listen to those who've written the awards, and as you said, in their own words. But as you mentioned, encourage people to look at the awards and listen to the winners. Actually read their essays out, and you can get it online on our program. We look forward to that collection coming up. We'll be love to share it with our worldwide membership. Finally, we have the last competition, and the last competition we have is going to be the Pulitzer Center for Crisis Reporting CUGH Global Video Competition. One of the things we try to do is to encourage colleagues to communicate their work not only through prose, but also through visual means. Visual means of we recognize if we're going to move people, we not only have to appeal to people's minds, but even more importantly, we need to appeal to their hearts. And a powerful and important way to do that is to tell stories, and a powerful way to communicate that is through visual means. And this was our effort to do this. And I really want to thank Ann Peters and the team at the Pulitzer Center for Crisis Reporting, now in the 6th annual Global Health Video Competition. So Ann unfortunately couldn't be here today. So in her place, I'm going to announce the winners. And there are 2 categories. The first is in global challenges, big global challenges. And the winner is called Gambia, the smiling coast of Africa. So congratulations to the winner of that. The second 2 are the honorable mentions. One is how air pollution impacts maternal and child health. And the other honorable mention is on cervical cancer awareness. The other category are high impact programs. And the winner of the high impact programs, it's called Academic Program Meets Humanitarian Goals. The honorable mentions, planet protectors, a selection, and the other honorable mention is the impact of mental health on underserved populations, a creative concept. Now you can see all of these videos on our conference website, and later we'll post them at the CUGH.org website. So you'll all be able to see the short videos that these groups have put together. Thank you to everybody who submitted, made short submissions. They're short 5-minute videos. They're meant to create an impact. So please, when you see them, please share them widely through your social media platforms and with the members and networks that you have access to in your organizations. That's the way we get the message out. And these short videos are powerful ways to talk about very big challenges, and also to share high impact programs that can make a difference in people's lives. So in closing, I just want to really like to thank a few people. First, again, to all of the awardees on behalf of us at CUGH, bravo, well done, and congratulations. To those individuals who have sponsored awards, again, these awards could not happen without you. So thank you very much for sponsoring the awards. And these awards are actually a product of the effort of our awards committee that's chaired by Dr. Tom Quinn from Johns Hopkins University, and one of our board members. Dr. Quinn does a superb job every year in being able to run the awards very well with the committee members. So thanks to them. And in support, Dalal Najjar, who does a fantastic job from my office in providing support to the committee as it adjudicates the awards that come in. So with that, I'm going to close, and we're going to close with some music. Our very own Jenna Smith, who has been the lead person running our conference, is also the front person for the band Pineapple. And her band has been providing us music throughout the conference. And we're going to show Jenna Smith and Pineapple on a song, and we'll close out on that very happy note. So congratulations to the awardees, the people who submitted, thank you. And we will close with this wonderful music, and we hope you enjoy the rest of CUGH 2022.